Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Procainamide. Its brand name is Procanbid. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now in this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Procainamide. Then discuss examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information. Let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Procainamide is a Class 1A antiarrhythmic. It increases effective refractory period and reduces impulse conduction velocity and excitability in the atria, Purkinje fibers, and ventricular muscle of the heart. In terms of indications or reasons we would prescribe this medication to a patient, we would mainly see it used in the treatment of life-threatening ventricular arrhythmia. And just note here, there are also 10 off-label indications that you may see it used for as well. With respect to contraindications or reasons we would not be able to prescribe Procainamide, well, we wouldn't give this medication to a patient who had a hypersensitivity to Procainamide or to any other component of the formulation. If a patient had complete heart block, they would not use this medication, as well as patients who had systemic lupus erythematosus. As well, patients with torsade de pointe would not use this medication. Now for dosing with Procainamide. So in the treatment of life-threatening ventricular arrhythmia, when the medication is used intravenously, the initial dose would be 100 milligrams every 5 minutes. There would be a maximum rate of 50 milligrams per minute until the arrhythmia is suppressed or 500 milligrams had been administered. Then you would allow 10 minutes for tissue distribution. For maintenance, again intravenously, you would see 2 to 6 milligrams per minute administered as 2 milligrams per mil. You would then adjust the dose based on clinical response. As with all medications, there are some side effects or adverse reactions that patients may experience while using Procainamide. We'll go over some of those here now. The one common side effect with this medication is hypotension or low blood pressure. Now, for some serious side effects would be cardiac dysrhythmia, agranulocytosis, bone marrow depression, potentially you may see hepatotoxicity or liver failure, systemic lupus erythematosus, as well as angioedema. Alright everybody, that's all we're going to talk about today with Procainamide or Procanbid. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.